I'm Dr. Robert Schmidt and I'm a facial plastic surgeon. Skin cancer is the #1 most common cancer in the United States. And it almost always occurs because of sun exposure that happens earlier in life. People like being out in the sun, it makes us feel good, but the UV light that's in the sun damages your skin in a permanent way. The least bad things that it does is it causes lines and wrinkles and little brown spots. But if you get enough of it, you're gonna probably get skin cancer. The goals with any skin cancer surgery are #1, to make sure you don't have cancer anymore. But second, to put things back together in a way such that it looks like nothing was ever there. And on the nose, that can be particularly challenging because you get into issues with structure and making sure that the breathing is important. And so sometimes we'll end up having to take cartilage from usually the ear to help to support that and make sure that your breathing is going to be as good as it ever can be. Usually we can have a very fine result from a skin cancer reconstruction with just one surgery. But sometimes we might need to come back and revise something to make sure that it's absolutely perfect. Because my goal with skin cancer surgery is to, #1, make sure you don't have cancer anymore, but 2, really make it look like nothing was ever there. The majority of skin cancer surgery I can just do here in the office. We numb you up. Sometimes people are a bit sore afterwards, but usually just Tylenol or ibuprofen takes care of the pain. You'll have stitches, which you'll have to take care of, and we'll give you information on how to take care of stitches. But usually you can be back at the office the next day as long as you don't mind having either visible stitches or a bandage. But certainly you're very functional, not a big deal in terms of surgery.
Well, our family doctor recommended him. His surgery was first because of cancer inside his nose. And so our family doctor here recommended Dr. Schmidt. Yeah, because, you know, his was a pretty complicated method of removing the cancer. And then mine, I was having problems with drooping eyelids. When I was reading my book at night, I was seeing a shadow at the top. And then I got looking at my eyelids, and I have scoliosis in my back, and it affects my neck. So I think that's what had caused it. What I've learned from all my friends, we've lived here for a long time, and they go to their dermatologist regularly. Well, the dermatologist recommend a doctor from the Woodlands that is a plastic surgeon that comes up here at the, well, I think maybe he comes across from the med, but kind of connected with that area. And so he does surgery. And otherwise, if Dr. Smith hadn't recommended Dr. Spit, we wouldn't have known he was here.
Mine's going smooth, both.
And mine, I mean, I had absolutely no pain, no discomfort. A couple of days after he did the surgery, I went ahead and went to the grocery store. I just wore my dark sunglasses and left them on in the grocery store. And then of course, he said no eye makeup for a month, and I almost thought, how can I do that? But I found out after he said use sunscreen and how to use it on my eyelids, I thought, I really don't need that much eye makeup on. I was out around our family and my closest friends after he took the stitches out, probably the next week, and no one said anything about my eyes. Would recommend him, definitely. In fact, I told after his surgery, of course, we went ahead in a week or so, I guess, and went to church, and we told everyone who he had gone to. Of course, when it's a cancer, it's very important, and definitely would prefer to be using a doctor that's local.
I'm Dr. Robert Schmidt, and I'm a board-certified facial plastic surgeon, and I can't wait to begin our relationship together.